Hello, everybody. Today I'd like to talk to you about heart health, oil, a combination, and how so many factors impact the heart. As you know, the heart goes lubbed up. Those are the noises when the heart valve closes. The heart function can be impacted by so many areas, so many items. What I'm holding in my hand right now is an omega oil precursor called flax oil. Flax oil happens to be an omega-3 plant. The flax becomes a fat in your body called DHA or EPA. EPA is the heart healthy oil. So many times people say, Dr. Bob, is olive oil good? Is coconut oil good? It's not that they're good or bad oils, but they're not omega-3 oils. That's really a very important distinction for you. So salmon would be an example of a food that can make the fat for your heart called EPA. EPA is eicosapentaenoic acid. DHA is the fat for your brain. So during the month of February, we're talking about heart health. You're going to say, why are the oils so important? Because they impact what we call your cardiovascular system, which is your heart system. So I have an omega 1000, which is 1,000 milligrams of omega-3 oils. Now there's a little bit of a difference here. This has to go through steps to be EPA for your heart. This happens to be pure EPA or DHA oil. You can say, okay, Dr. Bob, this right here will automatically make a difference in your heart and your brain. Some people have a hard time taking different marine oils. This is a plant-based oil, because I know some of you are plant-based food consumers. Both will do the same. This has to go through steps. Both of these will help reduce inflammation in your body. So a big distinction here. A lot of times we'll encourage our patients, our practice members, to do a blood test called the Opti Cardio Plus. This is a specific test that tells us about many areas, but especially heart function. To give you an example, CRP-H, C-reactive protein. That is inflammation in the body. Let's say you're going to a franchise restaurant and you're eating canola oil, safflower oil, sunflower oil. They're not bad oils, but they can cause inflammation in the body, which impacts your cardiovascular system. So what does that mean, Dr. Bob? Your body is inflamed. Oftentimes, I'll encourage individuals after we look at their LDL. Now, the LDL is not the bad cholesterol. LDL happens to be the type of cholesterol that takes certain items to the blood vessels. And in other words, if you have a lot of LDL, I know that your body's inflamed, has oxidation. You may consider doing some Omega 1000 or even flax oil. But the big issue for you is making appropriate lifestyle changes that will reduce your necessity to take those kind of oils. Now, I want to just kind of switch gears a little bit. That happened to be a liquid flax. And I want you to, when you get it, stir it really good and put it upside down in your refrigerator in a glass or a cup, because the lignin part of that is really very healthy. So get a skewer, a spoon, stir it really, really good, keep it upside down. You could use it as your salad dressing. Switching gears to another step, these are flax capsules in here. Usually, the recommendation is about a tablespoon of flax per 100 pounds of body weight. With the capsules, you could take 3 to 6 every day. As a side note, during the wintertime, February, people go to sunny locations. If you go to a sunny location and your body has not seen sunshine for a while, we encourage people, this is really important, to take a bottle of this with you to your sunny location with either a bottle of Bio-CMP or Calmagzyme. You're going to say, why? Because sunshine will cannibalize and use this up and the calcium up. So if you don't want to get sun poisoning or sunburn, 6 flax capsules a day while you're in the sun, 2 in the morning, 2 at lunch, 2 in the evening, plus 4 to 6 calcium on an empty stomach will make a very, very big difference. So flax capsules, you can take them on an airplane. The flax oil, you're not going to necessarily be able to take it in an unchecked bag. I want to go to another direction right now, that this is the liver and this is the heart. On the bottom of the heart, there is a valve where the heart and the liver connect. The reason I want to talk about this is Heart Health Month. And we have been really fortunate to understand that the liver, if it is congested for whatever reason, and the blood flows through this slowly, it impacts the blood going to your heart. So you could have heart distress because your liver is not functioning optimally. Maybe you're drinking too much alcohol, you're consuming too much juice, that you're making juice. Because I have a lot of you out there that love to juice, and I'm not telling you not to do it, but you don't want to do more than 8 ounces at a time. Because when you're juicing, you're placing a demand on liver function. Over-the-counter medications, prescription medications. Some of you are taking statin drugs. That is your choice, but one of the side effects of a statin drug happens to be liver disease. So I want you to start looking at the bad effects of some of the medications that you're taking, because they can impact liver, which can impact heart. And some of the body signals for liver congestion: varicose veins, spider veins, hemorrhoids. The liver is a whole nother topic, but it works so much with the heart. Now, there's another area that I want to talk about when it comes to heart health, are B vitamins. We probably have 5 or 6 different types of B vitamins in our practice. Some individuals come to see us and they have a slow heart rate. When you have a slow heart rate, we may recommend vitamin B1, and this particular product is called 3BG. It focuses on thiamine, or B1, which supports your adrenal glands and heart function in an indirect way. Also, some of you may be hearing your heart noise on your pillow at night. You may have cracks here in the corner of your lips. You can say, what do these have to do with your heart? This is called chelosis. Chelosis are cracks in the corner of your mouth. I have individuals, especially in the Naples office, that because of sunshine or stress or sugar, I'm not sure, it's pretty common. Riboflavin, vitamin B2. Now, when we look at your blood tests, once again, we look at your carbon dioxide, CO2. And if your CO2 is low, you need some thiamine. If you're having issues with your blood pressure being high, you might need riboflavin. This also has choline in it. Choline is important for liver function. So we have a product called BioB100s. We have a BioB complex. How do you know if you need B vitamins or not? Do you cry easy? Do you have noise sensitivity? Do mosquitoes like you? Do you have raw nerves? Do you go to bed at 10, pretend, and you wake up at 11 or about an hour or so later? Those are B vitamin needs. B vitamins impact heart function. If you have a racing heart, could be that you need the 3GB. So when you come into our practice and we have conversation with you, we're trying to help you drill down to get to the root cause of what's going on. You may consider doing a blood test called the Omega test. The Omega test evaluates DHA for your brain, EPA for your heart. Recently, I had someone that had a concussion, was responding slowly. We know from our experience of postgraduate training that oftentimes people with concussions that respond slow need more DHA in their brain. So you're going to want to go back and you're going to want to listen to this again, because the DHA is for brain health. You might have depression and anxiety. So what we're sharing with you as the drugless doctors, this is a very large puzzle. We have been all trained very well to help you get to the root cause of your problem. And finally, before I sign off, when you come into the office and we do your spinal correction or your adjustments, the vertebra up here on your left neck and mid-back directly go and impact the heart. You know, when people get numbness in their left arm and they know they're getting a heart attack, or they have heart attack type of symptoms, that's because there's a nerve in the lower part of your cervical and upper thoracic that impacts your heart. So when you come in and you're getting an adjustment from us, it is like you're having heart insurance. Do you know what? We hardly ever have anybody die of a heart attack in our practice because we do those adjustments to the neck and the upper back. That's why your posture is so important, because if you're hunched over like that, that impacts the nerves that go to your heart. One other area. Back in the 1980s is when I learned that the pancreas, when overworked from eating sugar, can send a reflex back up to this part of your body. I have a degree in spinal engineering. When I was doing my training, the doctor always said one of the most difficult parts of the spine to take away pain was the mid-back. Well, that's when I was able to put it together that when you eat sugar, you can get left neck and mid-back pain. And if you are a big sugar junkie, and that pancreas keeps on referring messages back to your upper back, we have seen subluxation patterns in your upper back. You say, what are you saying, Dr. Bob? Upper back alignment can impact your heart. Sugar can impact your heart. So when you start really putting this all together, it's a blessing that you're in our office. You may have a friend or a family member that is having extreme testing done to them. And we're not saying not to have the test. We always like our practice members to drill backwards. For example, we've had people have ablation. Ablation is when they burn nerves in your heart to try to get your heart back into sync. I have one particular individual I know that had that done several times, and it was because of stress. We adjusted his spine, we had him take some B vitamins, and he has not had an episode yet. So heart health is a big puzzle. We're puzzle solvers. I'm Dr. Bob DeMaria.